Her key to success is loving. She says, I love what I do. When you're passionate about something, it comes out in you, and whatever you do. Chiropractic is in her blood. Welcome, Jill Westfall.
Today I was going to talk about healing naturally through chiropractic. I was going to get a little bit more in-depth into the things that I do. I talk about in my my 60-second commercial about the things that I do, but I'm going to get a little more in-depth with those. I typically put people into a category of three. So there are the people that would love to go to a chiropractor and they would love to heal themselves naturally, and that's just something that's innate in them. That's what they want to do. Then we have another group of people that are very medically oriented. They would rather take a pill or they would rather have surgery than to do something natural. That's just who they are, and that's okay. Everyone has their own options. So I typically don't tend to go toward those people. If they want my services, I'm happy to do that. But then we have those people in the middle. So I would rather everyone just focus on the people that are wanting chiropractic, or the people that are on the fence and thinking, you know, I used to do this. I used to take a pill for this, or I used to go to the doctor for this, but there may be something that you could do for me. And those are the two groups of people that I think are much easier to refer to me. I learned a long time ago that what I do is what I do. I've been doing this for 26 years. I've seen amazing, amazing results from what I do. And I don't try to sell what I do. What I do works, and if people want it and they're open to it, they will come to me and I can help them. If they're not open to it, it's not worth getting into. So those groups are the good ones for you to send to me. Dealing with the anxiety of going to a chiropractor. There are multiple people that have anxiety before coming in because they really don't know what chiropractic is all about. So people that come in to my office that have neck and lower back pain, sometimes it bothers them somewhat. They have a little twinge here or a little something there, and it's not that big of a deal. Sometimes people have extreme amounts of pain. So on a pain scale of 1 to 10, 10 being they need to go to the emergency room, people are walking in my office sometimes at 8, a 9, or a 10, and it's so intense, they trust me, they come to me, and I can help them with that problem. But there are a lot of people that are in that extreme amount of pain that feel that they need to go to the emergency room. I can deal with 98% of these problems. When people have that intense amount of pain, it's a nerve problem. It's something that I can deal with, that medication and injections and so forth aren't going to get rid of the problem. I want to not only help you get out of pain, but help to get rid of the actual problem that's creating it so that it won't keep coming back. Numbness and tingling. Some people that come into my office with these neck problems and these low back problems, it refers down into the arms and into the legs, and it can create numbness and tingling, and that can be a very fearful thing when you're having that type of a problem, but it's something that I see all the time and I can help out with greatly. Sometimes people come in with weakness. I'll often ask people if they come into me with lower back pain, when you're walking, do you ever feel like your knee is going to give out? It happens all the time with people that have low back pain. The nerve is being pressed on. I liken it to an electrical cord that you plug into the wall. Our nerves are our electrical system. If the plug is only somewhat in, you may only get somewhat of the electricity you need to have going into your TV or whatever it might be. When that nerve is being affected, you're only getting a portion of what that nerve is supposed to be sending to your leg. So when you're walking and you move in a certain direction and it shuts off that nerve, your knee can give out and you can either fall to the floor or you'll catch yourself. But that can also be a very scary thing for people. An inability to sit down, stand up, walk, sleep. Multiple people that I have great difficulty doing any of these things for long periods of time. They can sit for a short period of time and sleep for a short period of time and stand for a short period of time, but none of them at any length. It's something, again, that I deal with all the time, being able to give them instruction on how to do all of these things to be able to decrease the inflammation in their body so it helps them to function for longer periods of time. And again, give them the tips that help to make sure that that doesn't happen again. Dizziness is a common thing that happens to people that have problems with headaches and neck pain. There's an area of your neck that's at the very top of your spine. When it goes out of position, can create a lot of dizziness. Typically when people come in with me, to me with dizziness, I do a thorough examination to make sure that there's nothing else that's happening with them that may call for needing to see a neurologist. But again, I can tell you 98% of the time that I treat people that have dizziness, it's typically because there's an area of their spine that's out of position. Once that is positioned, the dizziness just goes away. People with tinnitus, people that have the ringing in their ears, that's also another problem that's created from the neck being out of position that I can assist with. And people that suffer from headaches. A lot of patients that come into my office, again, we have those 3 groups of people, and every once in a while I can get that middle section to start coming in to get some treatment. They're taking medication. Oh, the doctor just told me when I get a headache I just take this pill and I'm fine. That's never getting rid of the problem. Typically people that come into me with headaches have upper back and neck tightness. We are all in a very sedentary world now. We do a lot of computer work, a lot of reading, stress and anxiety that we have in our lives now. It creates a lot of muscular issues in the neck and the upper back, which then create these headaches that people are suffering from. Taking a pill isn't going to get rid of that problem. It may help you after the pain has already come on, it may decrease it slightly, but you're going to continue to stay in this cycle of getting headaches. What my job is to do is to figure out why they're happening and how we can make sure that you get rid of them for good. So how I can help. Speaking about the numbness, the tingling, the weakness, the headaches, the machine that I have in my office called disc decompression, I can do not only on the neck but also on the lower back. It's a bed that you lay on. It looks like it's something out of the, 1500s where the horses kind of are pulling onto your arms and another one's on your, and it pulls everything out. When people come into my office and they have these types of intense discomfort, they'll often tell me, I really just wish that someone could just hold my head up, or I really just, I hang on things so that I can allow my back to just stretch out and it feels so good. They have this innate thing in their body letting them know what they really need and what they really want. When I put them on this machine, it gives them such an immense amount of relief. And people that have herniated discs or bulging discs at times will ask me, I don't know, I don't really want you to touch me because I have this herniated disc or I have this bulging disc. If you don't do something with those, they will continue. It is a degenerative process, meaning that as time goes on, it's going to just keep getting worse if you don't do something about it. If I can do something about the problem, you will have a less propensity of getting degenerative disease with these problems if I can get in there and get some movement. Disc decompression is probably the best tool, aside from my adjustment in my office, that can help me to heal people from headaches and disc injuries, bar none. By far, I get great results with the disc decompression. Electrical muscle stimulation, anyone who's ever played a sport, had an injury, seen a physical therapist, is probably familiar with electric muscle stimulation. It feels like little tingles. I put it on your back, put it on your neck, wherever it may be that you have tightness of the musculature, and what that does is it increases blood flow into those muscles and it aids in healing. So it helps the process of healing so that you can heal much more quickly. I have children that come in, I have people playing sports and so forth that I can help them with sprained ankles, lateral left condylitis or golfer's elbow, tennis elbow, those types of things, to be able to speed along the process of being able to help them feel more comfortable. Heat and ice, we all know. Nowadays what makes me crazy is all of these icy hot patches and these things that happen. Heat in itself will help greatly reduce muscle spasms. Ice will greatly decrease inflammation. Icy hot patches just fool your brain into thinking that something's going on. Pain and temperature are on the same wavelength, so it gives your brain something else to think about, but it's not making any type of physical change. So true heat and true ice are really the way to go. Something that I do in my office myself is I stretch my patients quite frequently to be able to open up the lower back and the neck. Strengthening, teaching people how to do strengthening exercises to make sure, again, these problems don't continue to happen, and then also, obviously, manipulation. Being able to talk to people about the different problems that they're having. A lot of people that come into me, they're telling me, I can't work. I literally can't work because I can't sit down, or my elbow hurts, or my back is bothering me. I have such bad headaches I can't work. An inability to work out because they have a workout injury. Their extracurricular activities, their normal things that they do around the house. Trying to go to the grocery store, doing yard work, washing dishes, working at their computer. These are things that I can help them with, not only to get rid of the problem, but to help them find new ways to do what they're doing to make sure that the problem doesn't continue to keep going on over and over again. So educating people on what the problem truly is and how to avoid it happening again is very, very important to me. At times, I have bracing that I need to do on patients. I had a patient that came in yesterday with an elbow problem that I needed to brace her. There are times I need to do that as well. Educating people on particular exercises or movements that they may be creating, continue to pain, that assures their long-term health. Again, I talk to people that I've been going to the gym for 20 years. I don't need you to help me figure out how to work out at the gym. My point isn't to change who you are, but just to give you some tips on things that you can do differently to make sure that the problem doesn't keep happening. And then helping people that don't move to be able to get into some type of a program. So those are great referrals for me. My time is up. If anyone has any questions, I'll see you after.
You want to give a testimony for Dr.
Dr.
Jill?
Yes.
Well, as many of you know, a couple weeks ago, I was in a lot of pain. I could barely walk into Dr. Jill's office, and I couldn't certainly sit at my desk. Well, she worked her magic on me, and she did like probably almost all those things she was up there because I was in so much pain. And I just want to say that, you know, I was one of those people that never believed in chiropractors.
Yeah.
But I went based on the testimonial of all of you saying how great she was, and I went and I just want to say it was fabulous. My back does not hurt at all, and I'm back 100%. So.
Hello, Judy. Hi, good morning. I have done 3 referrals and 2 one-to-ones, and I also want to do a testimonial on Dr. Jill. I sent my husband over to Dr. Jill, and he is like a new man. He wants to go to Dr. Jill every week, and I don't know what you did to him, but he can't go every week. But he says that anytime that he has some free time, that he will always go to Dr. Jill. So thank you so much.
Thanks.
A referral and a one-to-one. I mean, not one-to-one.
Thank you for
Close
close
business.
business.
And I also want to give Dr. Jill a referral. I have been going to Dr. Jill off and on for the past year, and I need to go back because when I leave there, I feel great, and you know, she really is wonderful.
Thank you.
Thank you. Oh,
Flores. Okay. Testimony for Dr. Jill. I know people that went to her think she's the greatest, but I haven't had a chance to go to her. Over these years, going to a lot of chiropractors, I've never seen so much passion and love for her occupation, which she gives. And I've seen a lot of these, in the chamber or wherever, and I've never seen somebody who loves her business, loves her clients, more than she does. So,
Thank you.
I have a testimony about Dr. Jill today. I don't know if it's love or passion what she does, but she's got this water board there that I've spoke about before. It's awesome. If you're ever in the area and you got 15 minutes, you want to relax, she'll put you on this board, especially like BNI members. If you can go in there without an appointment. You can stop in, get on that thing, and I'll tell you what, it's great. And I'm going to talk to Jill.